Let's go to a question from Chris here. I can't find doctors who support or understand carnivore style eating. They freak out about the cholesterol and want to put me back on statins, which I'll not take again. I requested knowing the particle sizes because of listening to you, doc, but they don't know how to interpret it. How many of you have ever asked your PCP or your GP something, and because you listen to Dr. Vadia or one of the other metabolic health people around, and your PCP or GP they gave you that deer in the headlights look, or didn't understand what you're talking about, or they answered, but based on their answer, you think they're making something up. Like they didn't actually understand what they're talking about. So, how common is this, Dr. Vedi, to see that almost everybody of the 72 people in the room has had their doctor not know what they're talking about at some point?
Yeah, unfortunately, it is common, and it's one of the problems with our system today. I have generally come to the conclusions that doctors are increasingly discouraged from thinking. They really have become just all about following protocols. And I think that's a lot of the problems that we see within the healthcare system today. And I forget who asked the question originally, but I would challenge that person a little bit and say, you have found doctors, right? You found me, you found the other doctors, my colleagues who talk about this stuff. So what's stopping you from switching your doctor, right? And it can be me, it can be many the other doctors. I think I saw at some point in the chat, and we'll repeat it again. Go to the Society of Metabolic Health Practitioners. These are doctors like myself who have decided to make metabolic health a priority in their practice and in their patients, and find one to work with. You can work with doctors via telemedicine today, right? We see patients all across the country, all 50 states. You don't have to come see us in person. And again, I know other doctors like that. So, if there isn't someone local, then you decide that you're going to make this change. And I know one of the biggest objections that comes up around that is my insurance won't cover it. And that's when you need to ask yourself, is your insurance company really having your best interest in mind? And if they're not going to cover it, is it worth whatever that investment might be to make sure that you get taken care of in a way that you want to get taken care of?